more than half of Medicare enrollees enroll in these private plans called Medicare Advantage that are sort of overlaid on top of just the regular traditional fee-for-service Medicare program. These plans are like, plans you've heard of, like United and Cigna, Aetna, et cetera. And they essentially administer the Medicare program for over half of beneficiaries at this point. They are large companies that work with plans and providers nationwide. So what happened was, when MA, the Medicare Advantage plan, was conceived, it was thought of as a cost saver, right? Because plans should have this incentive to reduce costs, because if they reduce costs, then they actually get to pocket the amount that they're saving the federal government. So there's a strong incentive for them to save money. But unfortunately, that has not happened over time. In part, that is due to the fact that the way that MA plans are paid is that they get additional funds for each beneficiary who joins their plan based on how sick they are, right? So, which makes perfect sense. You would definitely, you want to make sure that these plans are not looking for only healthy people. We want them to serve everyone. So the federal government pays plans a little bit extra if somebody enters the program who is more ill than your sort of average traditional Medicare beneficiary. And as people join the plans that are sicker and sicker, the plan gets more and more money. And that makes sense, so that they can cover the cost of this person who is sicker and sicker. The problem is that over time, plans have gotten really good at making the people that enroll in their plans look as sick as possible. And in some cases, some of these diagnoses are questionable. And the way that they do this is through all kinds of different means, but it has really exacerbated the difference between people who are in the traditional Medicare program and people who enroll in Medicare Advantage. So now everyone who enters, for every enrollee who enters Medicare Advantage plans, those plans are paid way more to care for this person than they would have, than the traditional Medicare program would expend if that person had stayed in the traditional Medicare program. So it is driving costs like crazy. It's kind of shocking.